Dyslexia is a language-based disability derived from differences in brain structure and brain function.
As a classroom teacher, there were always a number of students in my class who were not learning as well as the other students, and they were as bright as the other students. They had all of many abilities that everyone else had, but they were really struggling with learning to read. And I didn't know how to teach them. I hadn't been taught in my teacher ed program to teach those kids to read. And I asked for help. I mean, they did everything I asked them to do. I did everything that I knew to do. They weren't making progress. So that's how I ended up doing what I'm doing now, in searching for ways that would work for them. And those students with learning disabilities, specifically in the reading and written language areas, who do have dyslexia, they're usually average to above average in their ability. The difficulty that they have is very specific to reading. So they can learn to read, they can learn to write and spell, but they need to be taught in a way that may be different from how other students are taught.
Every child, as you know, is precious, and each birth has to be complemented by a good and healthy systems. Most importantly, the central nervous system, which comprises of the brain and spinal cord, is the axis which innervates all the muscles of the body and makes movement, playing, everything possible. As all of you know, the human brain has got grey matter and white matter. The grey matter is concerned with intelligence, and the white matter is concerned with movements and sensations. So the intelligence of a child and the intelligence of a puberty person, or when a child matures into an adult, is predominantly a function of the grey matter. And therefore, all abnormalities of memory, abnormalities of intelligence are disorders of grey matter. A child is born usually after a comfortable gestation in a normal pregnancy, and the development is being watched not only by the parents but also by the relatives, friends and the community in large. It is usually at the stage of early learning as a toddler and then as a preschool child. The male or female child born is being assessed in total by the community as such. And here is the focus of knowledge about various neurological diseases of pediatric age, especially the common ones. A child, when viewed by a non-medical person, can have various attributes which emanates into the community, but the most important one is the learning process. And here we have a spectrum of diseases which can affect the learning process of a child, in which dyslexia is the most common learning disability.
Dyslexia makes it tough to read and spell. The problem is inside the brain, but it doesn't mean the person is dumb. Different people are affected to varying degree of dyslexia.
Now, my view on dyslexia is the view of a practitioner. I'm an educational psychologist, and I used to be a teacher, so for me it is, I see children who have difficulties with reading and writing, and I try to find out why they have these difficulties and what we can do about it. So the early signs of dyslexia or of general reading and writing difficulties are already before children come to school. Children who later will develop reading and writing difficulties very often are not interested in early childhood when they're told about the nursery rhymes. They don't want to pay attention to the sound qualities, it doesn't interest them. But they may have in any other regards very normal development of their physical abilities and of their language abilities. So when they then come into kindergarten, the children often find it difficult to understand that you have sentences are made up of words and words are made up of sounds, and to distinguish the sounds between words. For example, children usually are able to first of all understand the first sounds of words and understand that there is a middle sound and an end sound of words. Children who will develop reading and writing difficulties often find that very hard to do. And when the teachers practice with them things like recognizing first sound and letter writing, they don't really know what the teacher is talking about. And from a practitioner's point of view, it's very important for a teacher to understand that. For example, to teach children to write letters and then hope that they will be able to put this letter together to make words, it will not work, because these children have problems understanding that words are made out of sounds. So letters don't make any sense to them. They may be able to say what the letter name or the alphabet, letter sounds, they may be able to draw the letters, but they don't actually know that the word stamp, for example, is made up of the sounds st, m, p, and that these individual sounds are associated with scribbles, which are letters.
They need to have it taught to them as language is a multisensory process. Every single language task involves at least 2 modalities. So teach, for example, even speech, you have to think about what you want to say, so you're essentially hearing it, that inner auditory, and associating that with the mechanism for speech, which is the kinesthetic modality. And so teaching kids in that way. Even young children who may exhibit some difficulties that you can see early on. They may have trouble with remembering the names or the labels of things. They may not enjoy books. Most kids, young kids, enjoy books that are read to them where they have to rhyme words. And if kids don't, then it might be something, it's just a sign. It doesn't mean necessarily, you're not diagnosing them, but it's something to look for. But and as they get into kindergarten and first grade, if they're having trouble remembering the names of the letters, or again, if they're having trouble remembering the names and labels for other things. And then once they're into school and into the early grades, then you see that they're having, even a student with a very strong oral speaking vocabulary, because we're wired for learning to speak and understand language, but we have to be taught to read, write, and spell. So a student who has a very, very high level oral vocabulary may enter first grade and suddenly start having difficulty with the code. So associating the letters with sounds and being able to use that to figure out what words are in print. And the same, and then it's even more difficult for spelling.
As all of us know, the intelligence of a person is assessed by a test called IQ, or intelligence quotient. The term IQ was coined by Terman. The common myth among the medical profession as well as the general community is that a child with normal intelligence on the IQ score will always be successful, and this is where the disease of dyslexia is an exception. That means the learning can be defective. The language processing, reading function, writing function, and the ultimate scholastic performance of a child can be abnormal even if the IQ is normal. So, dyslexia, a learning disorder, is the inability of the child to process the language.
Okay, so how do we actually know if the children are showing signs of dyslexia? As I already mentioned, this can be seen in preschool, but it becomes more obvious when they are in kindergarten. And often teachers are puzzled by the fact that children actually seem to be reading in the sense that they have a good understanding of, when they see a story, which words go with which pictures, but they are not able to actually use that to understand words they haven't seen before. What these children are doing, they're actually memorizing pictures. They're reading not the sounds of words, but they look at the words such as house and then have in their head a mental image of what the house looks like. So they associate this picture of the sequence of letters with a picture of the object it describes. They don't actually know that the letters H says the sound and then that the other letters are making up the rest of the word. So teachers will be, depending on the methods they're using, and the best method for teaching children is actually follow the development of their understanding of sounds by teaching them the correspondence between letters and sounds rather than teaching them whole words and teaching them sentences when they do not understand that words are made out of sounds.
The cause of dyslexia is believed to involve both genetic and environmental factors. The underlying mechanism involves problems with the brain's processing of language. Dyslexia is diagnosed by a series of tests of a person's memory, spelling, ability to see, and reading skills.
What are the abnormalities in dyslexia and how do we recognize this disease? Typically, the dyslexia is not identified initially by a doctor or a neurologist in the consultation chamber. It is the school teacher or the parents themselves who discover that the child is not able to read, the child is not able to spell properly, the child is not able to repeat a word, and the writing skills are bad. So much so that it becomes a difficult process for the child to start learning at school. At this moment, the neurology doctor may be called for an opinion in the sense that any genetic or environment abnormality which may cause an apparent brain organic damage has to be ruled out. But various studies have shown that the brain structure as such in a dyslexic child and a normal child is normal, and hence there is no specific diagnostic tool or a single investigation which is a pinpointer to the diagnosis of dyslexia.
So the children will be just not following the other kids. Very often these children in kindergarten year 1, grade 1, will often have behavioral difficulties because they just don't know what the teachers are talking about. They will be able sometimes to read quite well sentences, but then cannot understand very simple words, and that is very typical. Because what the children actually do, they try to memorize images. So if you have an image for a longer word, then the image is very distinct from other images. But if you have an image for words like out, from, in, then they all are very similar. So they can't actually memorize them very well because they're not distinguished in their brains. So the children simply will not pick up the reading and writing. Often when teachers don't clearly listen to children, they will not see that the child is actually not reading but memorizing. For example, when we carefully listen to younger children reading, when they substitute words, when they say words which make sense but which actually do not sound at all like the word on the page, it will give us an understanding that the child has been visually memorizing and does not analyze the words. So what teachers need to be doing is very carefully observe children, what they're doing. Similar in writing, if they can write a longer word, say garden, quite well, but they constantly confuse very simple words like they, there, or very regular words, then we know that what they're doing is actually writing down pictures, not writing down sounds. When we go a little bit higher up in primary school, children will have major problems by about grade 3 or year 3, because that's when this visual strategy, just memorizing words, doesn't work anymore, because there are too many new words coming up and the writing becomes more complex, so the children actually cannot keep up with their peers, and it becomes obvious that there is a difficulty.
Language it is an intersensory functioning, so it means the automatic linkage of auditory, visual, and kinesthetic impressions within the brain. So that means that auditory, the hearing or the sounds associated with the visual, with the letters, and the kinesthetic would be the muscles for producing speech sounds, as well as the muscles in the arm for writing. And students with dyslexia have not necessarily a weakness per se in any one of the areas, but in integrating. So a student may see a letter and remember that letter. They can even find it on the page, or they can find it in the room, but they may not remember the label for it. So that's going from visual to the label, which would be auditory, and then to say it would involve kinesthetic. The same thing for a word. They may see a word and they may know they've seen the word before. They can point to it somewhere else and say, but they don't remember what it is. And they need to be taught from the simple to the complex. So they need to be able to look at a word and recognize what the letters are and the sounds that go with those letters. But at an even lower level, that phonological processing, because dyslexia is a neurobiological difficulty, and it has a phonological component usually that's causing the difficulty. So if a student can blend sounds together, this has nothing to do with letters, but before there are even any letters. So if they hear the sounds s, n, a, if they can blend those sounds together into a word, snap, or the opposite of that, if they hear the word splash, if they can segment that into s, p, o, a, sh, then they're showing us that they have an awareness that that word, which only means something when the sounds are together, can be taken apart. And that helps them both with decoding for reading and spelling. And so if they can do the blending and the segmenting, or they could do a similar thing where say splash, say it again without the slash. Remember, we're not doing letters here, just sounds. If they can do those three things at a rudimentary level, then they're ready for letters and phonics, and then they can be taught to decode and encode with letters as well as the sounds. But they need to have some idea of that segmenting and blending, because it gives them an idea of the place value, so that they know that G-I-R-L is not equal to G-R-I-L. It really matters. The sequence of letters, the sequence of sounds makes a difference.
Dyslexia is not a disease to have and to be cured, but a way of thinking and learning.